Hello everyone, I'm Vishal Aggarwal. I'm a clinical academic dentist with a research background in clinical epidemiology. And today I'm going to tell you briefly about the collaborative work we've undertaken in the Mouth Matters in Mental Health study. This work was initially funded by UKRI Closing the Gap and more recently by NIHR. The initial collaborative work started between Dr. David Shears and Dr. Jasper Premier-Klaus, you see here. And David is a GP carer for somebody with severe mental illness and had a passion to drive this project forward as he'd experienced firsthand how poor oral health can affect mental health of somebody who is suffering with severe mental illness. So we collaborated with statistical colleagues at the University of Leeds and used population data from UK Biobank and US NHANES studies to show that people with severe mental illness had much poorer oral health than the general population, and there was a huge inequality. And this led to the convening of a much larger multidisciplinary group to act on these findings. And here you can see members of the group, which consists of GP carers such as David, users such as Gordon, Johnston, psychologists, psychiatrists, academics, and importantly commissioners from the Office of the Chief Dental Officer. So a variety of academic, NHS institutions and funders involved. This led initially to the development of a consensus statement, with the Right to Smile consensus statement, which sets out 5-year targets to improve oral health in people with severe mental illness. And very briefly, the first target was that any assessment of physical health in people experiencing severe mental illness must consider oral health. We need to improve access to dental services for people with severe mental illness, and the importance of oral health in people experiencing severe mental illness should be recognised in healthcare training systems and structures. The benefits of working in this multidisciplinary group thus far outweigh the challenges. My top tips would be to include patients and carers at the outset in the group. This highlighted to us the need for the whole person and whole team approach right from the start. We're able to understand the problem from the patient's perspective, and this was critical as we quickly discovered that oral health had a direct impact on their mental health. The team then had a common goal to focus on, and we prioritized that oral health should be a priority really at the point of diagnosis of severe mental illness, and this defined the direction of travel for the group. It was imperative to work with mental health teams to increase awareness of the importance of including oral health in their physical health checks for people with severe mental illness, and really to address this across the mental health severity spectrum. So it may differ for people who are hospitalized due to severe mental illness and those who are in the community with severe mental illness. All this needed shared ownership between mental health teams, dental teams, and carers, and putting the patient at the center of that team. A collaborative and not a competitive approach was needed, and we drew on the strengths of the group in leading various arms of multiple work streams which are quickly starting to show impact. So these are my top tips. Thank you for listening.